If you are preparing for your MMI interview, do not panic. The MMI is an interview format used by different universities in order to screen admissions to medical or dental schools. It is comprised of a series of interview stations, and each station will test you on a particular scenario or question. So in this video, we'll be going through 12 of the most common MMI stations that come up each year to help prepare you for any scenario that might come up. Let's get right into it. Up first, we have roleplay stations, and these are used to assess a candidate's empathy and communication skills. In this station, you'll be faced with a situation that you would normally encounter in the real world. An actor who is often in distress will present to you with a problem, and you'll have to approach them to try and help them or talk them through it. This could be a patient who is distressed about a recent diagnosis, or an elderly person who needs help getting to the grocery store. The key to doing well in this station is to always demonstrate empathy, to use active listening and phrases that acknowledge the person's feelings and concerns. We then have professional judgment stations, which will assess your judgment skills and your ability to communicate in pressured situations. This station may include a role play, but it might not. And it typically presents a scenario where a patient or a colleague is doing something that they shouldn't be doing, such as engaging in unsafe behavior. Maybe you discover that one of the doctors is drinking alcohol when they shouldn't be, or stealing drugs from the hospital, or maybe a colleague is cheating on an exam. The key to this station is always prioritize patient safety. This station is all about communication skills and your ability to build trust while making professional decisions. Now, as we continue on to the next stations, this video is actually part of a series that we're doing. So if you are interested in finding out more and watching some more helpful videos, then check out this playlist. Moving on to prioritization stations. These stations will test your reasoning skills and your ability to make quick decisions. In this station, you'll be presented with a scenario and a list that relates to it. It could be something really simple, like you're going on an expedition trip and you're given a list of 20 things and you need to pick out the 6 most important. Others can be more medically relevant. For example, you may have to choose 5 patients who can be treated after an accident. These skills are important for a doctor to have, as you'll have to triage patients and make decisions based on priority. In this station, there's not necessarily a right answer, but there is a right way to answer. No matter what you choose, try to explain your rationality and why you're choosing certain things over others. And also explain the negative traits that discouraged you from making certain decisions or choosing certain options. The next station is the giving instruction station. This station will test your communication skills and your ability to present information, which is an essential skill for doctors. In this station, you'll have to explain to the examiner how you would do something really simple, like tie their shoelace or write out a word. This may sound really easy and straightforward, but the examiner will not do anything that they are not explicitly told to do. They may even mess it up unless you tell them exactly what to do. So being really clear is key. So in this station, you need to be as thorough as possible. You need to assume that the person has absolutely no knowledge or no understanding of the action that you're trying to get them to do, even if it's the most simple thing. We then have calculation and data interpretation stations. These will test your ability to sort relevant information and be able to use that to make calculations and conversions, an essential skill for doctors to have. You may be presented with a graph or a table which shows information from financial or medical sources. You'll then have to use information like ratios, minimum and maximum values, and proportions to calculate the answer. This could be finding out the proper dosage for a patient depending on their age and weight, for example. For this station, speed is vital, so make sure to practice mental maths and quantitative reasoning. At FutureDoc, we teach our students different tips and tricks to help improve these skills, so if you'd like more information, check out our website. We then have PBL stations, which will test how a candidate works in a group setting. PBL stands for problem-based learning, and it is a style of teaching that many medical schools use. Yourself and other candidates will be presented with a case that you'll have to try and inquire about. The key to doing well in this station is to make sure your voice is heard but try not to speak over other people and interrupt when you shouldn't. You need to demonstrate good teamwork and communication skills and listen actively so that you can respond appropriately. We then have description station. These will test your attention to detail and your ability to communicate things in a concise manner. In this station, you may be presented with a picture that you'll have to describe in detail. The picture could be of anything. It could be of a house or a crowd or a forest scene, and you'll have to use your communication and your descriptive skills to explain everything that's on the image. The most important thing for this section is to stop, take your time at the beginning, and to plan what you're going to say. You could start by speaking about what you see generally and then going into more detail. Moving on to ethical scenarios, these stations will test your understanding of medical ethics. The 4 pillars of medical ethics are autonomy, beneficence, non-maleficence, and justice. Typically in this station, you'll be presented with a scenario where some of those values come into conflict. A common question you could be asked is having to choose who to give a transplant to: a 60-year-old who is an alcoholic or a 30-year-old who is father of 2 children. The key to answering medical ethics questions is to understand that there isn't always a right answer, and interviewers aren't necessarily looking for an end point. What's more important is that you're able to demonstrate an understanding of all of the issues and the complexities of medical ethics and these situations. Try to touch on as many of the pillars of medical ethics as possible and relate them back to the scenario. You may also have a personal statement station. This station will confirm that you are the person that you say that you are in your statement and will assess whether you have the qualities required to become a good doctor. You may be asked specific questions about your statement, or you may also be asked more general questions like what qualities would make you a good doctor, for example. The key is to make sure that you go over your personal statement before you interview, but try not to over-prepare what you're going to say. You don't want to sound too scripted or rehearsed, but you want to sound natural and able to present yourself in a professional and clear manner. We then have medical knowledge stations. These will determine whether you have a realistic view of what a medical career is like and what insight you have into medicine. I would make sure that you have read up on hot topics, specifically things that involve the NHS, and also any other medical advancements that may have recently been in the news. I would also pick an area of medical research that you are interested in and do some further reading into that. Another very common station is the confidentiality station. This will again test your ability to communicate as well as your understanding of the doctor-patient relationship. In this station, you'll be presented with a scenario where you'll have to handle sensitive information. For example, a young person wanting information on how to get tested for a sexually transmitted disease without their parents finding out. The key to doing well in this station is to handle the situation sensitively and to be aware of the principle of doctor-patient confidentiality and how that applies in the situation. Make sure that the patient feels comfortable before going on and asking any more medical or private questions. And remember to show empathy and validate any concerns regarding confidentiality. And finally, you may be presented with a scenario stations, which will test your problem-solving skills. This type of station will be similar to a roleplay station, but you'll only be asked to explain what you would do in the situation instead of acting it out. The situation may also not be necessarily related to medicine, but it will center more around the actions that you would take. For example, if you witnessed one of your classmates being bullied by someone else, for example. For this station, you want to think about why you're making a certain decision. Also, take into consideration the emotions of the people involved and how your action will resolve the problem. I would consider approaching these questions in the same way that you would approach a question in the situational judgment test of the UCAT. So those were the 12 most common MMI stations that come up each year. The MMI is designed to test different aspects of your character in order to demonstrate skills that you have. If you don't perform well in one station though, it's not the end of the world, as you'll still have all of the other stations to perform well on. I hope that this video has given you some insight into the types of questions and scenarios that you will be asked. This is just one video in our series of interview preparation, so if you'd like to watch more helpful videos, check out this playlist. Thank you guys for watching, and I'll see you next time.